Let's move on now. Syngene, a business unit of Biocon, India's leading biotechnology company, is getting ready for an IPO. In this exclusive conversation, Kiran Mazumdar Shaw, CMD of Biocon, told me that the IPO could happen as early as August and explained the rationale behind hitting the capital markets.
Biocon is actually at a very, very interesting and exciting inflection point. Because 5 of our biosimilar programs are in phase 3 clinical trials, and that to global clinical trials, which really is the largest number of programs in a single organization which is at such an advanced stage of clinical development. These are partnered programs, no doubt, with Mylan, a very large, as you know, global generics company. And so I think the fact that we've got so many programs in phase 3 clinical trials means that, of course, we need huge investments and, to further these programs, because these are very, very expensive programs to take to the market. And we believe that biosimilars offer a huge global opportunity for us and for Mylan. It is always considered to be the next bolus of growth for the generics industry. And there are very, very few front runners in this space. And therefore, we want to take full advantage of ensuring that we are first to the market in many of these programs. In order to do that, obviously, we will have to invest in these programs. And, we really don't believe that we should be borrowing money to invest in these programs. So we believe we can raise capital. And the way we are doing it is to monetize our investments in Syngene. Syngene has, been extremely successful as a research services company. It has now attained critical mass, and we want to give it its own independence, and we want to take it to the capital markets and for an IPO. And I believe that, Biocon can do very well monetizing its stakeholding or shareholding in Syngene. And this is our way of basically raising capital that is required to invest in some of these very important programs.
Could you give us a ballpark of how much do you hope to raise, and by when will this issue hit the markets actually?
Well, it's just a matter of weeks before you'll know exactly what the numbers are. But suffice to say that obviously when the last round of funding was at a market cap value of 3,800 crores, obviously we expect to do much better than that when we go to the market.
Your partnership with Mylan that you alluded to on generic insulin, could you give us an update of where that partnership stands and what the real plans are?
Well, as I mentioned, this is a very exciting partnership. This is a very fruitful partnership because we are the only company globally in the biosimilar space that actually has got 5 biosimilar programs in global phase 3 clinical trials, and many of these programs are actually going to complete their clinical trials sometime next year and file for regulatory approval. And I think this is a huge signal that the partnership has worked extremely well, that that we have actually succeeded in basically adhering and complying with the kind of biosimilar requirements. And the fact that these products have made it to phase 3 clinical trials will only herald the huge upside that we can get from these kind of businesses. And as I mentioned, we are one of the few front runners in this race, and we hope that we will be first to the market in many of these programs.
Sure. By when do you expect, ma'am, your Malaysia plant to get qualified by the developed market regulators, the US and EU, and what kind of products are you hoping to get out of that plant?
So basically the Malaysia facility is really dedicated to the insulin portfolio. So insulin analogs are really going to be the first off the block from that particular facility as far as the Mylan partnership is concerned. And of that glargine, insulin glargine is really the first off the block. And insulin glargine, the trials are at a very advanced stage, and we hope to basically file for regulatory approval sometime in 2016. So I think this is going to be a very, very large opportunity for Mylan and Biocon. I think in terms of qualification, the Bangalore site is obviously going to be supplying into the market first, but in the interim, we also expect the facility to be qualified for other developing markets, and very soon thereafter we expect it to be qualified for supplies to the US and European and other such markets.
Kiran Mazumdar Shaw from Biocon. Coming up next, we're going to be talking about the economy. Industrial output shocks the street.